Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick note whether I'm audible and visible, everyone. Am I audible and visible, everyone? I believe I am. Yes. Okay, that's great. So, Zoya, you can see that this class is for everyone, right? Not only to specific students, this is open to everyone. And today we have a very special class because we had some fun today on Sunday. So, basically, we had a quiz that we had conducted, right? And let me show you the quiz results. Highlighting the toppers of the today's quiz. The today's quiz was on anatomy. There were 10 questions, and we are going to discuss those 10 questions here. So, Gauri Bhagat, Guna, and Sri Lakshmi, you can see these are the three students who got all correct. And then we have Sayantan and Dr. Arpan, 10 on 11. Right. So, for the students who want to join the daily targets timetable that we are following, you can join the Telegram group. That is Dr. Nikita's Radsynapse. T.me Dr. Nikita is what is the group link. And so tomorrow in the target, what do we have tomorrow in the target is, tomorrow it is going to be neuroanatomy. Right, so your tomorrow's target is basically to complete neuroanatomy. So make sure you do that, and I'll be sharing the daily target videos also. So I'll be sharing some neuroanatomy videos with each one of you so that you can watch those. Now, quickly starting with the discussion of the today's question. Good evening and a very happy evening everyone who are here on a Sunday night, and again that proves your dedication and determination to crack this exam. Okay, so starting with the first question. So basically, as I said, we have 10 questions, and each one of those, basically, I'm going to tell you the mnemonics. So what you can do is you can write down these mnemonics at one place so that you can keep revising them whenever you want to. So question number one, lumbricals are present in which layer of the soul? Thank you, Shruti, means a lot. Lumbricals are present in which layer of the soul? Lumbricals are present in which layer of the soul? Yes, anyone, what's going to be the answer to this one? Let me see here. What's the light chat? Okay, absolutely right. This is basically the answer is A. It is the second layer. So how you can remember this is, remember lumbricals is like lumbricals. Lu is like 2 2. Okay, so remember that Lu is like 2 2. So that means so the lumbricals Lu is 2. It is present in the second layer of the soul. So can you tell me what else is present in the second layer of the soul? So one we said is the lumbricals. Lu is 2 2. So we have the lumbricals. Apart from that, can someone tell me what else is present in the second layer of the soul apart from the lumbricals? Yes, quickly, so that we can carry on with the discussion quickly. So what tendons, what muscles are basically present in the second layer? So remember that it is, I hope I'm able to see the live chat. Correct, but I can't see the answers. Okay. So look at this table here. So what do you have in the second layer of the soul is the 4 lumbricals muscles plus the 2 tendons. Which tendons do we have there? Yes, it is flexor digitorum longus and flexor hallucis longus. So FTL and FHL, you can remember this as Lu is 2 2. Right, so the lumbricals in the second layer, and the other L stands here for the longest tendons. So the FDL and the FHL, the FDL and the FHL, those are the two L's basically which are there in the second layer of the sole. Plus you have flexor digitorum accessorius. Okay. So what do you have in the first layer? Remember that in the first layer it is AFA, in the third layer it is FAF. So A comes first. So in the first one you have A, the two A's. In the third one F comes later on, it is the two F's. Which are the two A's? Is it adductor or is it abductors? So remember the AB abductor comes first, not the AD. So if you look at the dictionary wise also, so remember that abductors come first, adductors come later on. So it is abductor, hallucis and digiti minimi, the great toe and the little toe, and you have the flexor digitorum brevis. Here what do you have is, here we have FAF, the two F, that is the flexor hallucis and the flexor digiti minimi. Remember these are the brevis muscles, and you have the adductor hallucis. Okay, and you have the adductor hallucis. What is present in the fourth layer of the sole? Remember in the fourth layer the mnemonic for that is tip. For the fourth layer the mnemonic is tip, that is the tendon of tibialis posterior, the interosseous muscles and the tendon of peroneus longus. So remember tip is 4 or 4 tip. Telegram link is Dr. Nikita's Radsynapse is the group name. Right. So I hope you will remember this. The Lu is 2, so you have lumbricals and you have the LL, that is the longest tendons, that is FTL and FHL are present in the second layer of the sole. Right, so the correct answer here is 2. So we have discussed the topic of the layers of the sole as well. Next one, elbow joint is what type of joint? Wow, that's great, Shreya. Glad to know that I am helping the MBA students as well. Thank you so much for getting back. That really means a lot. And wish you all the best for the next attempt. Okay, so elbow joint. So remember that the trick for the upper limb joints starting with the elbow. Yes, very good. It is H-E-E-H. Remember the palindrome? Aise padho ya aise padho. It is H-E-E-H. So if you look at the joints here, starting with the elbow, we have the elbow joint H, wrist joint E, metacarpophalangeal joint E, and the interphalangeal joints H. So it is the hinge joint. Elbow joint is the hinge joint. Then you have the wrist joint. Then you have the metacarpophalangeal joints. And then you have the interphalangeal joints. Okay. Going on to the next one. Vagus passes through the diaphragm through which opening? Is it T8? Is it T10? Is it T12? Or is it none? So the easy trick to remember that कि vagus कहाँ से जाता है? Remember vagus is cranial nerve 10. So it passes through T10. Okay, that is the trick to be remembered. So vagus is passing through T10, and along with vagus, the T10 opening basically is the IVC, esophagus, or the aortic opening. So remember that vagus is rhyming with esophagus. Right, so that is vagus is esophagus. So basically that is through the T10, vagus and esophagus. And also for the diaphragmatic openings, remember 8, 10, 12. It is IOA. You can remember as Indian Olympic Association. Okay, it is Indian Olympic Association is what you can remember. And that is IVC, esophagus and aorta T8, T10, T12. Along with IVC goes the right phrenic nerve. Remember IVC is on right. Esophagus के साथ vagus, and you have the esophageal branch of left gastric artery. Along with the aorta, you have all the ducts. So you have the artery, you have the vein, and you have the lymphatics. So aorta, azygous vein, and thoracic duct. Look at the openings also here. T8, T10, T12, anterior to posterior is how they are located. The one which is present in front of the vertebra is the aortic opening. The one which is present in the central tendon, which opening is present in the central tendon? Remember C for C. Cable opening is present in the central tendon. So IVC opening is in the central tendon. So this is what for the diaphragmatic opening. So vagus is cranial nerve 10. So it is T10. Along with vagus, it is the esophagus and it is the esophageal branch of the left gastric artery, right? I hope all of you are listening to this and making note of that. Give me a quick thumbs up so that we can move on to the next question. Very, very important next question, that is the segments of liver. Very good, Tanay. That's a good mnemonic also there. Voice of America, that is vena cava, esophagus and aorta. Okay. What do you think is the answer to the next question, guys? Segments of liver in the right anterior section. So I'll try to simplify this topic of segments of liver for you. Right. So remember that in the liver segments, first of all, the right lobe and the left lobe of the liver. So what is dividing into the right lobe and the left lobe of the liver? So this is the line that you have here, the Cantley's line. Basically, you have the middle hepatic vein here, the right hepatic vein and the left hepatic vein. So three lines dividing into four parts. Middle hepatic vein is the one which is in the midline and dividing into the right lobe and the left lobe of the liver. Now, starting with the upper half and the lower half. What divides the liver into the upper half and the lower half is basically the branching of the portal vein, the right branch and the left branch of the portal vein. So portal vein branching ke upar, portal vein branching ke niche. Now we have understood that what is dividing into the four parts and what is dividing into upper and lower half. Now you will start from the left side, starting with the number 2, because you know that segment 1 basically is the caudate lobe. Okay, segment 1 is the caudate lobe and it is present posteriorly. Okay, it's a posterior segment. Now starting with 2, keep on doubling. 2 ka double 4, 4 ka double 8. Right, so it is 2, 4, 8. Going from the left to right, it is 2, 4, 8 and then you have 7. नीचे वाला आप start करो next number से 3. It is 3, 4, 5, 6. So 4 ऊपर भी है, 4 नीचे भी है. It is 4A above, 4B below. A for above, B for below. So it is 2, 4, 8, 7, 3, 4, 5, 6. Easy, right? So now, if you look at this one, basically if this is the midline, okay, this is the midline here. This part is the left lobe. This part is the right lobe. So this part is the left medial section. Okay, this is the from the midline, the midline ke paas mein hai, that is the medial section. This is the left lateral section. Now to the right side, so the liver is going like this. So the first which comes towards the midline is the anterior and then the liver is going posterior. So this is right anterior and this is right posterior. So if I draw a schematic diagram here, basically like this, and we are dividing by the 3 lines. So starting with the third line also here, starting with the first one, 2, 4, 8, 7, 3, 4, 5, 6, 4A, 4B. This is right anterior, this is right posterior, this is left medial, this is left lateral. Now the question was on right anterior, so the right anterior is going to be 5 and 8. Okay, the right anterior is going to be 5 and 8. Is this clear with everyone? So the liver segments, this is asked from the surgery perspective as well. He a surgeon, there's a tumor in the left medial section. So what segments basically we are going to remove? So left medial is going to be what segments? Left medial will be what segments? So left medial is basically 4. And 4 is your quadrilateral. So remember that is the quadrate lobe. Okay, that is the quadrate lobe. So 2, 4, 8, 7, 3, 4, 5, 6 is what we have. Okay, 2, 4, 8, 7 and 3, 4, 5, 6. Going on to the next question here. Not derived from the vitelline vein. Which of these is not derived from the vitelline vein? M and Joy, what did you not understand here? From the left, you have to start with the number 2. 2, 4, 8. Keep doubling. 2 ka double 4 ka double 8. Then 7. Niche 3, 4, 5, 6. Right? Which of these is not derived from the vitelline vein? Very good. Correct. Correct, Suhasini. Yes, Sayantan. It is superior vena cava. Okay, it is superior vena cava, which is not derived from the vitelline vein. The trick to remember here is when I write vitelline, so look at LIV. Okay, look at LIV. So basically, it is liver related veins are developing from the vitelline vein. Okay, so remember that it is liver related vein that is developing from the vitelline veins. So you have the hepatic vein, you have the portal vein. We know that close to the liver, there's a part of the IVC also which is there. So that is why this is from the vitelline. So remember, vitelline is LIV, that is liver valley veins. Superior vena cava comes from which vein? Superior vena cava comes from which vein? Thank you, Dr. Yashraj. Still more miles to go, right? There are miles to go. Okay, Prabesh, SVC is only from the common cardinal vein. So basically remember that in the fetus, we have the anterior cardinal vein, we have the posterior cardinal vein, which forms the common cardinal vein. Okay, we have the anterior cardinal, we have the posterior cardinal and the common cardinal. Anterior cardinal is the superior part that will contribute to superior vena cava. Posterior cardinal vein coming from down inferior, so that is going to be inferior vena cava. So basically contributing to the development of the superior vena cava will be the anterior and the common cardinal vein. The part of the anterior and the common cardinal vein will be the superior vena cava. Posterior cardinal vein will be IVC, anterior will be SVC. Here also, if I ask you, it is the right side or the left side of the cardinal vein. This is going to be the right anterior and the common cardinal vein. Because we know that the SVC, the IVC, they are present, the veins are present on the right side of the body. So remember that it is the right anterior and the right common cardinal vein, not the left. If the left side is also persistent, that means right be here, left be here. That will give rise to double SVC. Okay, that will give rise to double SVC. Alright. So remember that vitelline is liver related veins. Okay, vitelline is liver related veins. Going on to the next question related to the aortic arch derivatives. Tell me, what do you think is incorrect in this question? What do you think is incorrect in this question? Which option is incorrect? So I had shared this video also, the aortic arch derivatives, on day 1 when we started the 140 days timetable for NEET PG as a daily target video. Yes. Thank you so much, Ajit. Means a lot. Absolutely right. It is D. Okay, it is D. So that means the incorrect statement here is arch of aorta is from the right fourth arch. Now, talking about the aortic arch derivatives, let me tell you the quick tricks here. Carotid, remember C is the third alphabet. So it is the third arch. Carotid, C for third alphabet, it is the third arch. Pulmonary artery, what is arising from the first, second, third, fourth, fifth and sixth? Remember 5 has no life. So 5 se kuch nahi aayega. 1 is the arch of M. So you have maxillary artery. 2 is the arch of S. So you have the stapedial and the hyaloid artery. 3 is the third alphabet C. From 4, basically on the right side and the left side. Now remember that 4 limbs. So the fourth arch is the one which is contributing to the limb arch, that is the subclavian artery on the right side. On the left side, remember arch is made up of 4 alphabets, 1, 2, 3, 4. So arch is the fourth arch, the arch of aorta, and the aorta is coming from the left side. It is present on the left side. So this is going to be the left fourth arch. Is it clear with everyone? So 4 limbs. Subclavian is a limb artery. So this is going to be from the right side. And arch of aorta is going to be from the left fourth arch. Fifth से कुछ नहीं आएगा. Sixth से क्या आएगा? 6 is basically like the two lungs. So the lungs ka artery, that is the pulmonary artery, and the artery joining the pulmonary artery and the aorta, that is ductus arteriosus. Okay, that is ductus arteriosus. So remember, when I write D, the ductus ka D is basically like a 6. Okay, that is the mirror image of 6. So remember that the D is basically like the 6 ka mirror image. So it comes from the 6th arch, and that too it is from the left 6th arch. Okay, it is from the left 6th arch, not the right. So very, very important, ductus arteriosus is from the left 6th arch. Now, can you tell me the drugs that keep the ductus arteriosus open and the drugs that keep the that close the ductus arteriosus? So, subclavian artery basically comes from the intersegmental artery. On the right side, a part is contributed from the right fourth arch. बताओ, डक्टस आर्टेरियोसस को ओपन करने के लिए कौन सा ड्रग यूज करेंगे? Is it going to be NSAIDs or is it PGE? Very good, absolutely right. So this has been asked in the recent exam also. Remember, open. When I say open, it is PE, that is prostaglandin E, keeps the ductus open. Endomethacin, okay, remember endomethacin is ending the ductus. That means it is closing the ductus. Endo is ending. Okay, so it is closing the ductus. So NSAIDs are closing. PGE, prostaglandin E, is keeping it open. Okay, I hope this is clear with everyone. Going on to the next one now. So this table we have already discussed, the derivatives of the aortic arch. Going to the next one, which of these is not true about musculocutaneous nerve? Yeah, Komal, please to watch all the videos. I think there's an anatomy binge revision video also, which is there on my YouTube channel. Please watch that as well. And if possible, please to attend the Short 150 course that is happening in Delhi on 10 to 12th of July, if you are there, because I'll be covering a lot of topics, the most important topics from all 19 subjects. Not true about the musculocutaneous nerve. Okay, that's great. Amazing. This is not correct. It supplies the brachialis and the brachioradialis. Brachioradialis, remember, radialis is supplied by the radial nerve. It's basically the muscle. The brachioradialis muscle is a muscle of the extensor compartment of the forearm. So it is supplied by the radial nerve. So musculocutaneous nerve supplies which muscle? It is BBC, that is coracobrachialis, just the brachialis, and biceps brachii. It supplies all the brachii, because brachii means the arm, and it's the nerve of the anterior compartment of the arm. Right? So you have coracobrachialis, biceps brachii, brachialis, not brachioradialis. Brachioradialis is the muscle of the forearm. Okay? So remember that it does not supply brachioradialis. Next, it's a branch of lateral cord of brachial plexus. Absolutely right. From the lateral cord, you have LML. So the M stands for the musculocutaneous nerve. It pierces the coracobrachialis. Correct. It pierces the coracobrachialis. And it's a mixed nerve. The term itself tells you it is musculo and cutaneous. That means it supplies the muscle. Plus it is sensory also. That means it is motor and sensory both. So can you tell me that what is the sensory nerve, from where this musculocutaneous nerve carries the sensation? Is it the medial forearm? Is it the lateral forearm? Is it the medial arm? Is it the lateral arm? So what cutaneous nerve does it form? Right, it ends as lateral cutaneous nerve of forearm. Right, I hope all of us know that. It ends as the lateral cutaneous nerve of forearm, and when it comes into the forearm, it ends as the lateral cutaneous nerve of forearm. This is one of the recent PYQs of the NEET PG exam also. A patient coming with history of trauma, injury, has complained of inability to flex the elbow, Loss of sensation, lateral forearm. What nerve is injured? It is musculocutaneous nerve. Okay, it is musculocutaneous nerve. So remember all these important points for musculocutaneous nerve. Okay, very, very important. So look at this one. Basically, it is showing you the lateral cord. And from the lateral cord, you have this nerve coming, which is piercing this muscle, which is coming from the coracoid process. So this is coracobrachialis, piercing through it, giving a branch to it. It supplies the biceps, it supplies the brachialis, and it ends as lateral cutaneous antebrachial nerve. Antebrachial basically means the forearm. Okay, antebrachial basically means the forearm. ठीक है? Okay, रेडियो के साथ anatomy का भी पूरा कोर्स ले लूं? Definitely. You know, because a lot of anatomy is actually integrated with radiology, right? It actually is integrated. Going on to the next question. Question number 8. The rotator cuff consists of the tendons of which of the following? Rotator cuff consists of the tendons of. Right. So what is going to be the answer to that? So remember, for rotator cuff, the 4 tendons that we have, it is 6. And specifically, we write the T as the small t to remember that it is teres minor. The small t is to help you remember that it is teres minor. Supraspinatus, infraspinatus, and we have the subscapularis. So it's not subclavius, it's not latissimus dorsi, it's not subclavius. So automatically the option becomes D. Supraspinatus, infraspinatus, teres minor, and subscapularis. Out of all of these 4 muscles, tell me which is the muscle which inserts on the lesser trochanter? Out of these 4 muscles, tell me which is the one which inserts on the lesser tuberosity. Sorry, not the trochanter. Trochanter is for femur. On the lesser tuberosity, which of the following muscle inserts? Inserts on lesser tuberosity is subscapularis. Okay, remember it is subscapularis which inserts on the lesser tuberosity. Sub matlab below, that is lower. So remember that subscapularis is on the lesser tuberosity. It is on the lesser tuberosity, not the teres minor. Okay, the rest of the 3 are basically on the greater tuberosity. The rest of the 3 are on greater tuberosity. Okay. Going on to the next question here, what is the function of the peroneal nerve? In the foot, what does peroneal nerve do? Does it do inversion plantar flexion, inversion dorsiflexion, eversion plantar flexion, or eversion dorsiflexion? What is the function of peroneal nerve? So remember, for the lower limb, that is for the foot. Okay, for the foot, it is, what is the mnemonic for that? What is the correct statement to this, guys? Yes, very good. Suhasini is getting it right. It's not inversion. It is eversion and dorsiflexion. It is eversion and dorsiflexion. So remember that the mnemonic is ped tip. Right? Foot matlab pedal hota hai na? Foot matlab pedal. So remember it is ped tip. What does ped tip stand for? Peroneal nerve causes eversion and dorsiflexion, while tibial nerve causes inversion and plantar flexion. Okay, inversion and plantar flexion. So remember that peroneal is eversion and dorsiflexion, tibial is inversion and plantar flexion. Which muscles cause the inversion? It is the tibialis anterior and the tibialis posterior. Tibialis anterior, tibialis posterior. So this is an exception here, that tibialis posterior, even though supplied by the peroneal nerve, tibialis anterior, even though supplied by the deep peroneal nerve, it is the nerve of the anterior compartment. It is doing inversion. Okay, this is an exception here. Okay. So remember that the mnemonic is ped tip. So the ped tells you that peroneal causes eversion and dorsiflexion. Okay, that is what the mnemonic is. Ped tip. Okay. Going on to the last question here. Right. So that was a quick session for the day. Tell me structure in the ear that develops from the second arch. Structure in the ear that develops from the second arch. Peroneus tertius is basically your deep peroneal nerve. The eversion is caused by peroneus longus, peroneus brevis. Now, read the question very carefully. The question is asking about, very good, Manasvi, yes, Sayantan. Second arch से आता है stapes suprastructure. So remember S. That means from the second arch we have the stapes suprastructure, not the foot plate. Okay, it is not the foot plate. From where the foot plate is coming? The foot plate, very good Santan, the foot plate is coming from the otic capsule, which basically forms the bony labyrinth. Okay. Now, malleus. The arch of M is the first arch. So, malleus comes from the first arch. Eustachian tube. Tell me, where does the Eustachian tube comes from? Where does the Eustachian tube comes from? Eustachian tube is derived from which of the following? Very good. So, Eustachian tube is from the first pouch. Okay, the Eustachian tube is from the first pouch. So, basically the middle ear cavity and attached to it the Eustachian tube. So, you have the middle ear cavity and the Eustachian tube attached to it. This is from the first pouch. Mohit, not the first cleft. Cleft जो है ये बाहर का है. The external auditory canal is the first cleft. Okay, Siddheshwar? Okay, Mohit, remember that it's not the cleft. Okay, Chandani answered it as cleft. It's not the cleft, it's the pouch. Okay, remember it's a pouch. Absolutely right, Shubham. So that is why the first pouch is also called as the tubotympanic recess. Okay, what is the tube and what is the tympanic? Tube is the Eustachian tube. Tympanic means the tympanic cavity. That is the middle ear cavity. Okay, that is the middle ear cavity. Right. So yes, that completes the 10 questions of the today's quiz. And again, congratulations to the top 5 performers of the today's quiz. So guys, let me know that how did you find the today's quiz? If you liked it, we will keep having such quizzes beach mein to assess your preparation and to help you then discuss that, learn the tricks also of the mnemonics and how to solve the questions. Komal, I'll try to do as much as possible, though I cannot promise on that particular thing. Right. So tomorrow's target is a neuroanatomy for you guys. So make sure you complete that. I'll be sharing the target video with you. So make sure that all the target videos that I'm sharing with you, you are watching it on the same day and you are making notes for those as well. Because in each session, you would be learning the tricks no matter what resource you are using. All the sessions would be an add-on, giving you an extra edge and helping you learn the easy mnemonics to remember the difficult topics. Okay? Okay, so thank you so much everyone, and yes, I can see that majority of you love the quiz, and we will keep having more such quizzes on the Telegram group. I'll keep sharing the links. So make sure you are connected with me on the Telegram group, because whatever sessions I take, I update you on the Telegram group. So you'll be staying updated there. Okay. Thank you so much everyone, and yes, thank you so much everyone, and goodbye. Take care and keep studying, keep revising.